Thank you so much, Dr. Eaton, for joining me today.
Thanks for having me. It's funny to hear you say Dr. Eaton. I'm still used to hearing people say my maiden name. So I was like, who's Dr. Eaton? Oh, that's me.
That's you. I've been following you on Facebook, and that was one of the reasons why I reached out to you to interview you. And I love you do a lot of videos, and you also put a lot of inspiring messages out there. And,
Mhm.
I want to know what first led you to become a chiropractor?
Well, the long story, I'll try to keep it short, that led me to being a chiropractor was that my aunt was injured when she was 16. She's just a few years older than me, so we're pretty close in age, actually. She was a cheerleader and a gymnast and a track athlete. She was cheering at a basketball game and was injured. She had a fracture of her cervical spine and became a quadriplegic after that experience. And so I spent a lot of time with my grandparents, and she lived with them throughout almost all of her life after that. And they would always do home physical therapy type of things with her. And I'd love to participate. And everyone told me I should be a physical therapist. And I've always loved sports and dance. And I was a cheerleader too. But I ended up going to a local university one weekend when I was in high school to try out for a dance scholarship there. And I got a scholarship. And being the oldest of a lot of siblings, I went to the school that was going to give me the most financial reward and didn't have a PT program. I didn't know about athletic training at that time. So I went through school there, ended up with my major in social work, and then just kept feeling this call essentially to chiropractic. And I had only been to a chiropractor a couple of times, been adjusted a couple of times when I had acute pain. And then as I'm feeling like I would talk to people and hear about chiropractic from people that were in school at Logan or that had gone to school at Logan that I knew from high school or childhood, I started looking on the internet, and this was like 2003, right? For more information. What is chiropractic? And the principles really resonated with me. By principles, I meant, at that time, it meant to me that the body can heal itself and that we don't need medications and drugs all the time to do that. And I thought, well, that's really cool because I've always kind of felt like a hippie. And so I just decided that's what I'm going to do next. And I did.
Wow, that's awesome. I hear that a lot from chiropractors that they feel that calling. I know I felt the calling too, and
Yeah.
you don't hear that in too many professions where they really felt that calling.
Yeah. At the time, it felt like, it was just a choice that I was making. But when I look back on it, I definitely feel like everything that had happened in my life to that point was leading me to that direction.
Right. And what do you enjoy most when you're in practice? What do you enjoy most about the day to day of seeing patients?
That's an interesting question for me because I've really transitioned recently in practice from my previous experience being a resident in sports and rehab at Logan, having a master's degree in sports and rehab, working as the assistant director of sports and rehab at Logan for a bit. That was my main focus. And at that time, I really loved helping athletes get back on the field and participating in their sport quickly. But since I became a mom, my focus really has been more so on babies and helping a mom feel more confident that her baby is healthy and developing normally and optimally even when she's feeling like, I don't know if they should be splitting up this much or I don't know if you should be this fussy. And I just love the ability to help a mom through that phase because it's so dang hard that first year.
I know. Well, my daughter's 12. It's still hard.
Yeah. Yep.
There's always something new that comes up. What kind of advice do you give moms that are going through these different transitions with their kids?
First and foremost, I keep it really simple for them because often they're feeling overwhelmed. And two things that they can almost always do without any excuse, whether that be time or money or otherwise, is they can breathe more deeply and they can drink more water. And almost every mom that I've ever talked to would benefit from doing more of those two things, myself included, of course.
Right. And I'm sure you've had patients, you've worked with practice members who maybe didn't use chiropractic for their other pregnancies, but then used it for, initially why they started coming to care. So
Mm-hmm.
have they ever shared with you the differences in how they feel, what their energy level's like?
That's a good question. And I find that for moms that have had more than one baby, in some ways it becomes easier mentally and emotionally for them. They feel more confident that everything will be okay. But that physically it's more challenging for them, especially when their babies are close together. And I've said this myself, and I hear a lot of them say, I don't know how I made it through pregnancy without chiropractic. I'm like, yeah, I don't know how I would have made it through either one of mine without chiropractic.
Yeah, I used to hear that a lot when I was in practice, that I would get a woman who had tried it for the first time but didn't do it, for other pregnancies. And they're like, oh, I feel so much better. I'm sleeping better. I have less pain. I wish
Hmm.
someone had told me about this sooner.
Yeah, yes,
Yeah.
absolutely.
So, how do you describe how chiropractic helps the body?
Yeah, I really focus on problems from the patient's perspective, right? And that's how I go about marketing, not just as a chiropractor, but also as a coach. What is the problem from the potential client's perspective? And what words do they use to describe it? So, what often moms are describing is low back pain and pubic symphysis pain and hip pain and restless leg syndrome, maybe headaches, right? And they don't have other options that feel safe to them to help alleviate their discomfort. And so I focus on those things to market. But then once a patient is under care and they know me and they start to trust me, I start then helping them to understand chiropractic from a different perspective, that it's not always mechanical. And it's not always just about how your joints are moving or not moving, but that there's also the emotional and mental components of how you're feeling, and what are you eating, and what are you drinking, and what are you exposed to in your environment. So I really take a holistic approach with every mom that I encounter, so that they have an optimal outcome.
Yes, so you take a very individualized approach.
Yes.
So you're
Yeah.
speaking to that patient or that person as
Hmm.
a person with what they're experiencing day to day.
Yeah, I've always, and I love that point, I've always wanted to give the kind of care that I would want to receive. And the kind of care that has always resonated with me is individualized care, that I know that the person who's taking care of me really gets me and understands what I'm saying, what I'm feeling, and what would be best for me. And so that's just that's my philosophy, I guess, has always been to give that back to other people.
Right. And it sounds to me that when you speak their language, that they're going to get it faster and also
Definitely.
develop that trust and rapport.
Yes.
Yeah, so that's really
Yes.
great. Now, if I recall properly, you're not a chiropractor right now. You're not working as a chiropractor, but you're just doing the coaching and raising your kids, which of course, just raising your kids is a handful, right?
It is. I treat from home, and I also do house calls. So, like yesterday, I went to a house call with a mom and a baby. The baby was 5 weeks old. The mom also has a 2-year-old who will be 3 in March. So her pregnancies are pretty close together. She had reached out to me via Facebook, by the way, and I don't know that we would have ever encountered each other otherwise without social media. But she just noticed that I was a chiropractor in a group that we were in, related to other topics. And she sent me a message and was like, do you think chiropractic care can help my baby? He spits up a lot. And I don't know that it's normal. And he twitches in his sleep. And I don't know that that's normal. And he's so fussy. And I don't know that that's normal. And I was like, awesome. So the nervous system controls the body, right? And if he has irritation to his nervous system, anything is possible. So let's just take a look at him and see what's going on. And if it helps him, great. And if there's something else going on, then we can figure that out too.
Yeah, that's great. And what initially led you to start doing coaching?
Well, long story short, again, was that in my first practice, which was a brick and mortar practice in like a strip mall type of setting, kind of the typical what we think of as like a normal practice, right? And my first daughter at that time, was a baby when I started practice there. I had just left Logan. I was like wanting to really hit the ground running, I was really, even though I was aware that it wasn't ideal to be doing this, I was really operating out of fear. I was really afraid that I was going to fail. And being afraid that I was going to fail meant that I worked a lot. I worked 9 a.m. to 7 p.m. or 8 p.m. And I worked like that most days of the week. I would work on Saturdays as well. If I wasn't in the office, the phone was forwarded to my cell phone. If patients called and needed acute care, then I would go in on Sunday sometimes. And it just got to the point where I was feeling so overwhelmed. Like, I wasn't feeling healthy. I wasn't feeling very happy, quite honestly. I didn't see my daughter when she was awake. And my husband and I were struggling with our relationship. And I was like, wow, like, I didn't know that practice was going to be this crazy. I knew to expect it to be challenging, right? Especially in the beginning. And I started looking for someone that could help me to feel less overwhelmed and figure out how to focus on what was actually important, not just in my practice, but in my life as well. And my to-do list was growing like exponentially because I have so many ideas being an entrepreneurial spirit that I think, oh, this will help me grow my business, and this will help me grow my business, and this will help me grow my business, and I should do it all. But what I didn't know then that I know now is that I don't have to do it all to get to where I want to go or to have the experience that I want to have each day. And I was so forward focused all the time that I was missing out on life. And I just really wanted to have someone that could help me through that and figure it out how to balance it all. But I never found that person. Never found that person that I felt like I really knew that they got what I was going through. And so in the process of all this, I became pregnant, and we weren't expecting to have more babies, but I was. And at the end of my first trimester, I had a miscarriage. And then 8 weeks later, I was pregnant again. And at that point, I was like, something has to give. Like, I'm not going to risk another pregnancy to continue to live life like this every day and feel so unhealthy and overwhelmed. And 6 weeks after that, I sold my practice. So it was a complete 180 from what I had been intending to do with my life at that point. But in the process of removing myself from a very busy practice for a while, then I started feeling like it was again just a feeling of like a calling that I know that I'm not the only one that felt that way. Especially I'm not the only mom that's ever felt that way. And if I felt that way and other people have felt that way, who is helping us? And without an answer, I thought, there's work to do here. And I get to be the one that's crazy enough to do it.
Well, and I applaud you, because one of the reasons why I stopped practicing was because it was such a difficult thing for me to balance home and work. And, most people want to come to you in the afternoon. So
Yeah.
that's when my daughter gets home. She's 12 years old, and the thought of her coming home to an empty house, because my husband's working too, or leaving her with the babysitter, just never felt good to me.
Mm-hmm.
So for me, I just started limiting my hours more and more, and eventually I didn't have much of a practice. But I just felt like this is what I needed to do now. So it was a choice that I made. But, having somebody like you mentor and guide people through that process of how to find balance I think women need it.
Yes, we do. And I think not only do we need it for ourselves, but the world needs us to figure this out as well. Because healthcare is hurting. It's not healthcare. We know that. But we as chiropractors are so capable of providing true health and wellness care to more people in the world. But when moms are leaving practice, then we don't get to do that. And we don't get to help the people that were here that we could help, that need our help. So when we can figure this out, when we can figure out how to practice, and whether that means you have a home-based practice, or you rent space with another chiropractor or someone else, another kind of practitioner, or you do have a more traditional, busier practice, so be it. Whatever makes you happy. But I really feel strongly that it's important for us to figure this out so that we can continue to help change healthcare.
Yeah, and when my daughter was really young, my husband was a yoga teacher, and we were able to to split our schedules up in such a way that one of us was with her until she turned 3. And that worked out really well
Yeah.
because they now have this amazing relationship because he got to be part of her, reaching all those milestones too. So
Mm-hmm.
it is tough. So what if I were to call you up and say, "Help! I'm having trouble balancing my life." It's just like with your patients. You talk about one or two things that's really important. Is there like one big thing that you would recommend for women that are having trouble juggling everything? And I know that's a really tough question to answer, but can you just share one or two things that you might tell somebody like me who
Mm-hmm.
wants to practice but is just having trouble balancing everything?
Yes. So for anyone that's familiar with AA, which I'm not an alcoholic, but I'm familiar with the 12-step program, right? Because I'm a social worker as well. The very first step in AA, the 12 steps, is admittance. Essentially, it's admitting that you're not feeling happy or that you're not feeling healthy or that things are just not what you want them to be. And like really owning that, because a lot of times, especially as women, especially as moms, we can put our head down and just do the work and kind of just grind through things and not pay attention to how we are feeling unhappy or dissatisfied with what's going on, and just continue to kind of stay that way, thinking like this is just what I have to do and get through it, and really not know like where the end is to that. But for a lot of people that reach out to me, especially, they just kind of feel inspired to connect. I tell them, like, sit down and write out your dream life, not your dream practice, your dream life. And then after you've gotten more clear on that, and as crazy as it looks, it doesn't matter. Like, how can we take a practice and fit it inside of that dream life? And let's start working toward that. And people are usually like, oh, it's not even possible to do that. It may not be. I believe that anything is possible. It may not be if you believe that it's impossible, first of all, but we at least get to start working towards something different than what you're experiencing right now.
Wow, that's fantastic. But what's neat is you could take that advice and give that to your patients as well.
Oh, yeah.
What would your dream life be like? Because then you're helping them on a bigger level. You're
Yeah.
like putting all the whole person, right? We talk about being holistic doctors where we're looking at the whole person.
Mm-hmm.
So you're a holistic coach.
Yeah.
Yeah, so you're looking at the whole being. Why do you think people are resistant to using coaches?
I think there's still stigma about not being able to do it all on your own, or to admitting that you might want some help, not necessarily need help, but even just want help. And again, for moms, it's often the most challenging for us to admit that we want to have help because we think we should be able to do it all ourselves. But what I can tell you from my experience is that when you work with someone in that capacity, things start to change in your life much more rapidly than if you were just kind of hanging out trying to figure it out all on your own. And so the benefit can often be hard to measure objectively, but it's often for a lot of people that have had a coach, whether it's with me or someone else, it's just like they're amazed at the outcome, even though they can't necessarily put it into words.
Well,
So again, I think that plays a part into why people are resistant, because they're unsure of what the outcome will be or what the benefit may be exactly. We want to know when we spend our money on something, what am I going to get for this?
right. And I think, though, that when you find the right match of coach and client, that client feels a weight lifted off their shoulders, right?
Mm-hmm.
Because you're sharing, you have someone to be accountable to, and you're sharing that stress almost. You're having someone who can see things that you can't see,
Yes.
right? Because when we're stuck in our stuff, it's
Mm-hmm.
so hard for us to see beyond our stuff to come up with a solution,
Yep.
right? Does that
Which is also why I have my own coach.
great?
Yeah. Yeah.
That's great. Now, I like to ask people about mentors? Like, are there a couple people that really stand out for you, either on a personal level or a professional level, that you look to as your mentor?
It changes because I am a fast learner and I implement things really quickly. So when I look back at the beginning of my chiropractic career, my mentor initially was Dr. Lanny Nelson. For any Logan graduates that were there between 2005 and 2013, they'll know him. If you ever encountered him, you know him. And he's very well known for his work in sports and rehabilitation. And so he was my mentor then. And this was actually why when I left Logan, I felt really overwhelmed because I was lacking a mentor. I felt like I was out there all on my own. And now I know that it's always important for me to have a mentor, and they do change. So Dr. Ed Osborne has been a big mentor for me. Other people in chiropractic in regard to treatment, Dr. Suzanne Seekins, she's amazing. She's in Florida. She also focuses on prenatal care and pediatrics. She's been in practice for almost 30 years, so she's just got an amazing gift to share with other people that want to learn more about those demographics. Outside of chiropractic, Alex Sharfin is probably my go-to mentor right now because he helps entrepreneurs create momentum in their business. And that's me. Like if I wasn't a chiropractor, I'd still be an entrepreneur. So that's very helpful for me to have an outside perspective, someone who's not a chiropractor but can take an objective look at me, understands my brain and how it works, and can say, this is like in a holistic way, this is how we can move you forward.
Great. And are there any books that have also influenced you? Like, do you have a go-to book?
Yeah. Like one that I recommend often is Loving What Is by Byron Katie. She's written 3 or 4 books, I believe, maybe more than that now. But Loving What Is an amazing book for people who feel unhappy in any part of their lives or feel stuck, and know that there is something else for them, and they're just not really sure how to go about figuring that out. Anyone that wants to feel more peaceful with life as it is right now, it's a great book for you. I read it a year ago. Actually, I listened to it on audiobook, and it was amazing. And I powered through it in like 2 days. I couldn't stop listening to it. And I really felt like from that moment forward, my mind has worked differently ever since.
Wow. I have to check that out. And
yeah,
what
it's
about
powerful.
For your patients, are there any books that you recommend for your patients?
Loving What Is. I recommend that one for a lot of them, especially moms. Yeah. Other things like Well-Adjusted Babies, of course. If a mom wants like a good reference manual kind of to have at home, I like to recommend that one. Yeah, I would go back to Loving What Is. Yeah.
That's your go-to book for everybody should read it. Okay.
Yes.
And if someone wants to reach out to you, if they're interested in coaching with you, how would they do that?
The best way to connect with me would be through Facebook. I really like to have people get to know me and my message and my philosophy on life and practice. And so they can find me on Facebook. I think if you just go search for Dr. Danielle Eaton, you'll find me pretty easily.
And I think there is not a space between the doctor and D for Danielle, right? It's kind of
correct.
All one. So I want to let people know that, because if they're looking for your doctor space Danielle, they'll miss you. We don't want that to happen. And what about a potential patient? If someone is in your area, and what part of you're in Missouri, correct?
Yes. Right now we live just outside of St. Louis in a suburb called Fenton, and we are moving next year. We're in the process of building a new home in Washington, Missouri, which is about 30 miles from where we are now. So we'll be about an hour to an hour and a half outside of the city. Some more rural, kind of country, lots of farms. There's also a lot of vineyards and wineries. Riverfront, parks. It's going to be awesome. I can't wait to be there in that new community. But potential patients that wanted to connect with me, I would also, again, send them to Facebook. That's like my go-to.
Okay. And your new office, are you going to have your office, your practice out of your home when you move, or are you going to have a separate location?
I'm currently undecided. I'll be making a decision soon. I have a couple of different office spaces where I may share space with other practitioners, but especially over the last couple of days, my heart's been leaning more toward practicing out of my home. And that's really because I want to share myself with my patients, and I want them to see my lifestyle because I want to model for them what's possible for them to experience. So I want them to know my kids. I want them to see what our house looks like. I want them to see what's in my refrigerator, even if that's what came up in our conversation. I would be able to show them, like, look, we have fruits and vegetables, and we have some meat, and we have some eggs. Like, this is what we eat.
Right. I'm walking the talk.
Mm-hmm.
Yeah.
Yeah.
It's also really nice for, the female chiropractors that might be listening, that when you work out of your house, if your kids are home from school sick, or, they have a day off, you can actually
Mm-hmm.
still see your patients and know that your kids are just a few feet away. For me, that's very comforting.
Mm-hmm. Well, and it goes back to me designing my dream lifestyle and then putting my practice inside of it, right? So for me, when I think about my dream life, I actually prefer to practice in the evenings. But if I'm doing or afternoon, evening, if I'm doing that, then just like you experienced with your daughter coming home from school at that time to an empty home, or for me, in my case, it might be because my kids are too little to come home and be by themselves. It might be with a nanny or a babysitter. I can be with them in the morning, schooling them in the morning, and I can have a nanny or a babysitter take care of them in the afternoon while I practice. That for me feels really good.
Yeah, yeah. I love that. I love that you don't have a one size fits all, both with your patients and with your coaching clients. That you
Mm-hmm.
really look at each person and meet their needs. I think that's really
Yeah.
wonderful. So I
Yeah.
just wanted, for anybody who's watching, I'm also going to give your websites out. You have alignedwomen.com
Mm-hmm.
and Dr. Danielle Eaton, EATON.com. So you can
Yes.
learn more about you. They can learn more about you there. And I also want to mention your podcast, which is,
Yes.
I forget the name of it. I didn't write it down. Name of your
So
podcast.
my podcast is the Aligned Women Podcast, and this is a podcast for moms in chiropractic. We talk about life and practice in this podcast, so it's a little different in that regard from other podcasts that are for chiropractors. And we talk sometimes about, we talk about breastfeeding, we talk about birth, and it's not always just about patient care or chiropractic practice or business. So we definitely take a holistic approach to the life of a mom who's a chiropractor.
It's certainly different. I know when my daughter was, I nursed her till she was 2.5, but the first 6 months, when she needed to eat, my husband would bring her to the office. And
Oh, wow.
yeah, it was great. We only lived, 10 minutes away, so we were able to do
Yeah.
that. But again, it made me feel good. It's not for everybody. And again, I love your approach, and it's been really great to meet you. And thank
Thank
you.
you.
Thank
Thank
you.
you so much.